Oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. I rise today with great concern over the way this government is proceeding with these drastic and wide-ranging changes to the education system. This legislation makes tracking and monitoring the changes exceptionally, and I hope not intentionally, but it is very difficult. It was pointed out over the weekend by a former member of this House that the current legislation had a big hole right where classroom inclusion, Mr. Speaker, was supposed to be. Now, in a mad scramble, we're trying to make amendments. My question for the Premier, did he accidentally misplace the inclusion clause, or was the intention to remove the clause from the bill in the beginning?
The Honourable Premier.
Mr. Speaker, the clause the honourable member was referring to actually was a clause in there directing school boards. If she goes back to the special education policy that the minister would fall under, Mr. Speaker, would actually hold the minister to that particular policy, which would ensure that we accommodate all students across this province to continue to make sure that they can thrive in particular classrooms. We heard from communities across the province, from people from the disabilities community, from parents who were concerned. We amended the bill. I think that's what law amendments is about.
The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. The point is that this piece of legislation is weak and it has gaps through it. It's hard to have confidence in this bill when the authors are still plugging holes at the last minute and drafting notes, Mr. Speaker, from Twitter responses. We've seen that. And even in light of the latest amendment, the Premier insists on fast-tracking this piece of legislation. How can the Premier be certain that there aren't any more crucial omissions in this piece of legislation?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for her question. It wasn't an omission, quite frankly, Mr. Speaker. I just explained where we felt that it was dealt with, but we heard from the community. That's what a reasonable government should do, and I want to thank those Nova Scotians who have thoughtfully looked at this piece of legislation instead of listening to the rhetoric coming from the opposite side of the House.
The Honourable Leader of the Official Opposition on her final supplementary.
Mr. Speaker, this is an extremely important bill. And like I said, there's all kinds of things being pointed out that's missing from this bill. And more importantly, what's the rush? Why are we rushing this bill? The Premier has already delayed the bill once. I know it was only for a few days. However, after that delay, we found that there was language missing from the bill, language that is crucial to hundreds of families in our province that are totally confused right now over this piece of legislation. Will the Premier please take the time to check this legislation and make sure that his legislative timetable isn't doing more harm to students?
The Honourable Premier.
Mr. Speaker, the only one confused, Mr. Speaker, is the Leader of the Official Opposition. The fact of the matter is I've heard from parents across the province who are grateful the government listened. I've heard from teachers across the province yesterday, some of whom are in my office, who thanked for us for listening, continuing to move this piece of legislation forward. And quite frankly, they're grateful for a government that recognizes that the education system has to change and a government that is prepared to act.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Yesterday at the Law Amendments Committee, we heard many thoughtful and compelling responses to the government's proposed revamping of public education in Nova Scotia. One of those many responses was from a woman named Cheryl Crocker, who spoke about how it was deeply troubling to her that the people that she had elected to the school board were being, these are her words, chucked out the door. So I want to ask the Premier, is he entirely impervious to the dismay that there is amongst the people of the province that a whole order of elected government in Nova Scotia is being chucked out the door?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. I want to thank all those who presented, Mr. Speaker, before law amendments. I want to thank those who came forward. I want to thank the minister and the people who sit on law amendments. All of those who actually voted for the amendment that was put before that. I want to thank the Democratic Party for recognizing that we should put the amendment forward we voted for. I also want to remind the honourable member, though, that he knows that school boards across this province on 5 different occasions, Mr. Speaker, have been completely removed by all levels of government, all governments in this House, Mr. Speaker. Quite frankly, for all kinds of different reasons, what we have created is an administrative model that reflects the reality of today, and we're looking forward to getting on with ensuring that we continue to transform the education system that is responsive to the needs of the individual communities and empowers teachers and administrators to deliver the quality education that our families deserve.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. In our party, we believe that when there are problems with an order of government, it calls for improvement and reform, not for obliteration. Now, yesterday, we also heard at Law Amendments from Pamela Lovelace. She drew attention to the fact that this debate is taking place right on the eve of International Women's Day, and the word she used when she spoke to her own reaction to the elimination of 57 elected women in Nova Scotia School Board, the word she used was heartbreaking. Mr. Speaker, the Premier is the author of this heartbreak, is the cause of this heartbreak. What manner of justification can he possibly put forward to all those people who are heartbroken by the erasure of so many women's elected voices in Nova Scotia school boards?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. I want to remind the Honourable Member that when he was in government and his party was in government, Mr. Speaker, they dismissed an entire school board across the province. They replaced it with one person on the South Shore. Mr. Speaker, they had other issues where they had to send someone into particular school boards. He would remember when they sent someone into Colchester County, Mr. Speaker, to deal with helping them build a budget. The reality of it is, Mr. Speaker, what we've done is created a structure that we believe reflects the reality of today, an administrative model that works for the people of this province. And I want to tell the Honourable Member and the person who was making the presentation that this government takes its responsibility serious when it comes to gender equality. That's why we, Mr. Speaker, have ensured that we have gender parity on the provincial family court benches in this province. It's why we had the opportunity to continue as a government to ensure that the seniors level of the government reflect gender equality, unlike that group of people, Mr. Speaker, who say one thing, quite frankly, when they have an opportunity, do the exact opposite.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, all I know is that what was being discussed were 57 positions which exist today and which, by the intention of this government, will not exist very shortly. Now, we heard also yesterday from Principal Pat Savage. One of the things he said, very interesting, was that in his evaluation of governments, a core matter he judges is what does that government do to advance the democracy of our province? Does it advance people's participation? Does it advance the meaningfulness of people's participation? Mr. Speaker, this Premier is taking all of our elected school board positions and replacing them with 12 appointed ones. So here's the question. What else can we conclude but that this government is diminishing, undermining, rendering smaller and weaker the democratic system of our province?
The Honourable Premier.
Mr. Speaker, what you conclude, Mr. Speaker, is that the Democratic Party is okay with the status quo. I'm glad he is. We're not, and we're preparing to move forward to transform public education so it responds to the needs of individual children across this province and it responds to the uniqueness of communities, and we're empowering principals and vice principals and classroom teachers to deliver the quality education that our children deserve. The status quo, this party is moving forward.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Last week, I was disheartened to read another story about sex trafficking in Nova Scotia. Young women, actually girls as young as 14, are actually convinced to, with great promises, with nice clothes, expensive gifts, and are forced into sex work, as many as 15 partners a day. While the vulnerable sectors of our society are the most frequent source of victims, the girls come from all areas of Nova Scotia, and recently an RCMP officer actually referred to sex trafficking as Nova Scotia's hidden epidemic, and I'll table that. I'd ask the Premier if he has had any opportunity to meet with law enforcement and other stakeholders to determine what the province can do to help combat this frightening and heartbreaking issue.
The Honourable Premier.
Thank you, Mr. Speaker. I have not, Mr. Speaker, met with other agencies outside on this particular issue. I do know that I have met with the Department of Community Services about children that we have in care, Mr. Speaker, who have been forced into the sex trade. As the honourable members raised forward, we're looking at ways that we can support those young women who are in our care to make sure that not only are we providing them a safe environment, but we're also providing them the place where we can help them get well. And we're going to continue to work with them, but I have not, to your point, I have not personally spoken with law enforcement agencies outside of on this issue.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker, and I want to thank the Premier for his thoughtful response. I don't pretend to know the answers. I know it's a great challenge, but I want this to stop. I want to help, and I think everyone here in this chamber wants the same thing. They are manipulated, they are cajoled, they are blackmailed, they are victimized and re-victimized, and leaving them with no way to escape until they are no longer useful to anyone that can help them. So I would like if the Premier could guarantee us here today that he'll work with the Justice Minister, the Education Minister, Community Services and Health, because I see them as being key role models in this, and I would just like a promise that we will move forward collectively together so that we can stop this.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable for the question. She is right. The barriers that sometimes are created in government within departments need to be torn down. We've worked very hard on a number of issues, Mr. Speaker. This would be one of them. As she alluded to, the Minister of Justice will play an important role, the Minister of Community Services, the Minister of Education, the Minister of Health. Quite frankly, all members of the Executive Council and members of this House need to ensure that we continue to make sure that our daughters have the ability to go to school and not worry about when they step outside and onto a sidewalk that they're going to be confronted by someone who has nothing but ill for them. Continue to treat them as nothing but non-human. We are going to continue to work forward. We have to make sure that our daughters know when they leave the presence of their parent, people who love them, that they're going to be supported by a community, that we will have in place the infrastructure that they can respond to that will keep them safe. We're working very hard to ensure that those who come into care to us are getting that way. But in your earlier question, in your preamble, there is no socioeconomic issue here. This is every one of our daughters. This is every one of our communities. It will take all of us to ensure that we continue to move this issue forward. I want to thank the member. I want to thank the member for bringing it to the floor of the House of Assembly, and I look forward to continuing to working with her, members of the Executive Council, and all members of this House to ensure that our daughters are safe.
The Honourable Member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Education. The much maligned Raising the Bar report contains a number of factual errors which have been widely reported on. Notwithstanding the Minister and the Premier's public commitments to the implementation of the results of the Commission on Inclusive Education, which we have not yet seen, the key provision of the current education guaranteeing inclusive education was not included in an effort to plough forward with these changes. Mr. Speaker, what reassurance can the Minister possibly provide to Nova Scotians that additional mistakes have not been made?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I want to be clear. It's not fair to suggest that a model of inclusion was not included in this Act. As I've informed that member, 61A says promote excellence in education and achievement of all students. So that is implicit. The model of inclusion is implicit in the language of this bill. All means every single child, each and every one of them. We do understand that the implicit language has created concern for families and that there is a desire to have explicit reference to inclusion. That's why we are moving forward with an amendment to the legislation to accommodate that desire. Thank you.
The Honourable Member for Dartmouth South.
Mr. Speaker, with all due request, advocates are crying foul and implicit isn't good enough. All day yesterday, we heard from parents, teachers, and others, many in tears, who brought forward a list of issues in our education system, both systemic and specific, that are crying out for urgent attention. More transparency in the school review process, more school psychologists, more supports for students learning English as an additional language, and more responsiveness for the needs of diverse learners. Had the government brought forward a proposal to address any of these issues in our classrooms and school system, I feel confident that they would have been met with support from all parties in this House. Mr. Speaker, why is the Minister insisting on pushing forward these reforms, the reforms that don't deal with any of these issues in the Glaze report, when they do nothing to meet our students' most urgent needs?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. In fact, more resources into the classroom, better education for rural students, a better capital planning process, all of those things that the member referenced are in the Raise the Bar report and are recommendations that have come forward from Dr. Glaze herself. People miss the report in its entirety because people have been focused on the controversial recommendations around a college, around around administrators coming out of the union. But, Mr. Speaker, despite those two things, which we actually believe are important objectives to move towards, in fact, this report has helped us chart a course for many of the issues that member brought up. Furthermore, we're moving forward with the report on inclusive education that will be coming out at the end of March, Mr. Speaker. And the fact is that having a more streamlined administrative model that is unified from one part of this province to the other will help ensure the smooth transition into that new model as well.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Environment. Recently, the minister announced reporting requirements for companies that will be forced to participate in the province's cap-and-trade program. We now know that about 20 companies will participate, and those companies will be required to report their greenhouse gas emissions to the government. What we still don't know is how much this is going to cost a farmer in Kentville filling up their truck with gas, a mother in Shettycamp buying cereal, or a student in Halifax trying to pay their electricity bill. My question is, when will the Minister of Environment come clean on what this government's climate change schemes are going to cost Nova Scotians?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I want to thank the member opposite for the question and remind all members in this House that there's a requirement set by the federal government that all provinces will have a price on carbon. We elected to go with the choice of a cap-and-trade system. It's the lowest cost system as an option for this province. It recognizes the work that Nova Scotians have done in the power, the rates that they've paid, and the increases that have been put in place by past governments. We will ensure that we have a system that is lower than the other provinces comparatively. It's a cap-and-trade system. We will be going out to consultation this spring, and we look forward to that discussion with Nova Scotians. Thank you, Mr. Speaker.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. The Minister of Environment said that, quote, we need to find our baseline. We need to set caps, and then we'll be able to have a discussion of what the impact will be for Nova Scotian consumers, and I'll table that, Mr. Speaker. I don't need to remind the Minister that this Liberal government announced nearly 18 months ago that they would be introducing a cap-and-trade scheme. That's 463 days, Mr. Speaker, that Nova Scotians have wondered, with little action and no clear answer from this government, how this scheme will hit their pocketbooks and how they'll pay for it all. The clock keeps ticking because even in his most recent announcement, the Minister had absolutely nothing to offer in terms of how the scheme will affect consumers. My question is, how does the Minister expect Nova Scotia families to budget and plan for the future when they have no idea when or how cap-and-trade costs will affect them?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. And as I said, we are moving forward with the cap-and-trade system. The legislation's through the House. The next step was to go forward with the quantification, reporting, and verification regulations, the most important regulations to have in place. This is a system that only impacts the highest emitters in the province that are over the threshold of 50,000 tons of greenhouse gas emissions. We look forward to getting that information so we can look at the emissions that they have today as a baseline. As I've said publicly, we'll be looking at setting the caps that are commensurate with the benchmark that is set in place by the federal government. It is the lowest cost option for Nova Scotians, and I'm proud of this legislation. Thank you, Mr. Speaker.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question is to the Minister of Community Services. Nova Scotians stopped using hair-based drug and alcohol testing in child protection cases in 2016 after serious shortcomings were found at the Mother Risk Lab at Toronto's Hospital for Sick Children. Between 1997 and 2015, as many as 380 Nova Scotians tested positive for drugs and alcohol based on data supplied by Mother Risk. This week, Senior Legal Counsel for the Nova Scotia Human Rights Commission says the government has a duty to look into those cases where faulty drug testing played a role in children being removed from the home. Mr. Speaker, my question is, will the Minister act on the advice of the Human Rights Commission and review the 380 cases where faulty testing from Mother Risk Labs played a role?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. Any time that we are looking into a child custody case, Mr. Speaker, we would use a variety of different tools to determine whether a child should come into care of the minister. Lab testing is only one of those tools, Mr. Speaker, and I want to assure the honourable member that no decision is made ever on the basis solely of lab results. Thank you.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. I would still encourage the Minister to follow up on the advice of the Human Rights Commission and look into those cases, because I know personally people who've been affected by those drug tests. My supplementary question is 2 weeks ago to the Minister of Community Services. The Supreme Court of Nova Scotia ruled that the Halifax Toxicology Lab that the department uses for drug testing could not offer expertise in a child protection case. The court said the lab was not designated as a forensic lab or subjected to external oversight. It's also unclear if the lab adheres to international standards. This sounds a bit like deja vu. So we're wondering, Mr. Speaker, the question to the Minister is how many child protection cases have involved testing from the Halifax lab, and is the Minister satisfied with the test results performed at this lab so far?
The Honourable Minister of Community Services.
I want to thank the honourable member once again for her question, and I would just say if she is aware of any cases where the mother risk lab results were used in a child custody case, to please have those families contact our department. We did ask people to contact us if they wanted their case reviewed, so I would please ask about that. In the case of the other lab, there have been no concerns raised at all about any of the work at that lab. It is simply that the justice in this case wanted to have a different standard, and we are reviewing that particular case. Thank you.
The Honourable Member for Cole Harbour Eastern Passage.
Mr. Speaker, over the weekend, Nova Scotians read about a Lower Sackville woman who believes her treatment by the Nova Scotia Health Authority put her life in jeopardy, and I'll table that document. After successfully managing her mental illness for a quarter of a century, Lisa Card says visiting the emergency room was one of the most devastating experiences she's ever had accessing mental health services. When she saw a doctor at the infirmary ER, Ms. Card said she was told that she would not be given any help and they would not review her medications. This even though she reported that she feared for her own well-being. The question is to the Minister of Health. Can the Minister explain how a woman who feared she was a danger to herself was sent home?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As the member would know, I'm not able to speak to any individual cases, particularly around privacy reasons for health issues that come up. But in a general sense, Mr. Speaker, when individuals show or present themselves, whether for a physical ailment or a mental health situation at an emergency room, they are triaged first by a nurse to identify the severity of the case, and then meet with the physician. The clinical physician does the assessment and moves forward with the appropriate course of treatment, is what the expectation would be.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. In that particular case, the brother of the woman took her back into the ER and insisted she get care, and they finally did bring somebody down to talk with her, which was different than the first time she went in the door because she had somebody else there advocating for her. The question in the same article, Dr. Sam Campbell, Chief of the Emergency Department at the Halifax Infirmary, said there is an 85% chance that people who go to the emergency department will not see anyone but the emergency room physician. While Dr. Campbell wouldn't say that the mental health system is broken, he says it's struggling. He went on to say it's unbelievably stressful working here at times, especially when everyone is unhappy. The system is making people wait far too long. My question to the Minister of Health, when Nova Scotians seeking to have help only have a 15% chance of getting beyond the emergency room doctor, the public is stressed out. Will the Minister admit that it's time to improve the mental health services for Nova Scotians in the province? The
Honourable Minister of Health.
Thank you, Mr. Speaker, and again, I thank the member for the question. I think it's important that when reflecting on data information, the reference to 85% chance that individuals presenting at an emergency room will only be seen by the emergency room physician, I believe reflects the fact that in those cases they're able to be treated by those physicians based on their expertise and the nature of the conditions they're presenting with. I believe the member may be inferring perhaps more into that statement that was made than was intended by the physician.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Community Services. Abdul Abdi came to Canada at the age of 6 as a refugee from Somalia. When he was 7, he was removed from his home, and while in the care of the Department of Community Services, he was shuffled between 31 different group and foster homes. During the entire time Mr. Abbey was in the province's care, the department failed to apply for citizenship on his behalf. When his aunt tried to apply for citizenship for Mr. Abbey, she was barred from doing so. It was the province's responsibility to apply for his citizenship, and because of the department's failures, Mr. Abbey is now facing deportation to a country he has not lived in since he was a toddler. Mr. Speaker, given the Department of Community Services' failure to appropriately care for Mr. Abdi, will the minister take immediate action to advocate against the deportation of Mr. Abdi?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. And as the honourable member knows, I'm unable to speak to any specific cases in this House. We do not confirm whether someone was in the care of DCS or not, and that's the law, quite frankly. But I do want to assure the honourable member that we do take this matter seriously. In the past, we have had a practice of applying for citizenship. We are now changing that into a policy. It has come up, it's a situation that has come up very rarely, Mr. Speaker. We also have the ability, Mr. Speaker, to extend a child's care in the care of the minister in a case where it's discovered that that has not happened, that citizenship has not been applied for. And I want to assure the honourable member we would always take any steps possible to make sure that that young person gets the citizenship applied for. Thank you.
The honourable member for Dartmouth North.
Mr. Speaker, we don't know how many other children are in this situation as we speak. The Deputy Minister of Community Services has admitted that the department still has no policy specific to children who are not citizens, and despite what the minister has just said, they don't expect to address this issue until 2019. Mr. Speaker, will the minister explain why her department refuses to make the necessary changes to prevent children in their care from facing deportation as adults? And could she address what she can do now to help Abdul Abdi? Thank you.
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I would note that when we extend the care of a child past the age of majority so that they can remain in our care while citizenship is applied for, we can't force anyone to do anything, Mr. Speaker. I do want to assure the honourable member that our government has been in contact with the federal government on this particular case, and I want to assure her we have done everything possible to assist. Thank you.
The honourable member for Dartmouth East.
Mr. Speaker, my question through you is to the Minister of Health. In his November 22nd report, the Auditor General said, quote, Dartmouth General is the only regional hospital in the province without a crisis response service and no psychiatry support to the emergency department. And I'll table that, Mr. Speaker. In response to the report, the Minister stated that 911 services are always available, and I'll table that as well, Mr. Speaker. Mr. Speaker, if someone in Dartmouth calls 911, they are taken directly to the Dartmouth General. If a Dartmouth resident in psychiatric crisis phones 911, they're going to end up at a hospital that doesn't have appropriate support. My question for the Minister is this. What good is a 911 service if people in crisis are taken to a hospital that doesn't have the treatment they need immediately?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for again bringing forward an important topic around mental health services. It's important for Nova Scotians to know that in addition to the services that are provided in communities when an individual is in crisis, that they can call the Provincial Mental Health Crisis Line, Mr. Speaker. They have professionals available specifically trained around mental health and helping assess the situation, working with those citizens that are receiving those services, and then can also coordinate and bring additional support services out to the individuals in crisis.
The honourable member for Dartmouth East.
Mr. Speaker, I'm sure the Minister would agree that when someone is in the grips of a mental health crisis, every second counts. When someone in Dartmouth calls 911, they are automatically delivered to the Dartmouth General. Mental health patients at the Dartmouth General can at times wait days to be transferred to the QE2, the closest hospital offering the services they require. This is a substandard level of care that, as the Auditor General pointed out, exists in no other regional hospital in Nova Scotia. My question is this, Mr. Speaker. When will the residents of Dartmouth get the mental health services they deserve and desperately need?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We continue to expand our investments in mental health care for residents in Dartmouth and indeed across the province, investing in our past budget for this fiscal year in hiring additional clinicians to provide supports and mental health supports in communities, supporting the expansion of Schools Plus and providing those support services there. Through our efforts to establish more and expand existing collaborative care practices, including not just frontline healthcare providers, but also clinicians like social workers and others to work in those collaborative teams, providing care in the communities for all Nova Scotians. Thank you.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. And Mr. Speaker, my question is for the Minister of Health and Wellness. In November, the Cape Breton Post reported that anyone under the age of 19 in crisis requiring psychiatric help would not be seen at the Cape Breton Regional Hospital's emergency department. None of the psychologists in the hospital are specialized in youth mental health. The emergency department was not comfortable with admitting youth in the adult psychiatry program. That means young people needing mental health care had to travel to the IWK 5 hours away, Mr. Speaker, for treatment. Mr. Speaker, this is totally unacceptable to the people and the needs of Cape Breton residents who already have to wait 157 days for adolescent outpatient community-based mental health services. So, Mr. Speaker, my question is, can the Minister tell Nova Scotians how many Cape Breton young people have been transferred to Halifax since November, and how long, Mr. Speaker, how long will this practice remain?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And I had the opportunity when I was last in Sydney about a month ago to actually stop by Cape Breton Regional Hospital. Indeed, I met the honourable member on my way in as he was leaving the facility to meet with a psychiatrist at the facility to talk about this and other aspects of mental health services in Cape Breton. Mr. Speaker, in that discussion, I wanted to gauge the psychiatrist's comfort with the approach that was taken in response. Indeed, what I was advised is that this is work with the IWK. It's the same approach and model used across the province, Mr. Speaker, and not all of those consults require transportation to the IWK. Many of those consults can take place through telecommunications as well.
The Honourable Member for Sydney River Myra Lewisburg.
Mr. Speaker, I'm sure that answer is very comforting to the parents of children that need this service. Is it somebody else's turn to question? Mr. Speaker, a few days ago, Mr. Speaker, I searched to see the number of job postings for psychiatrists in Cape Breton. There were 12 psychiatrists for various places, including Sydney, 2 separate postings for 4 psychiatrists for Sydney and Antigonish, a child and adolescent psychiatrist for Sydney, a psychiatrist for Sydney Mines. Mr. Speaker, I can't tell how many psychiatrists are needed or how many are being sought. Mr. Speaker, this is a crisis situation that the people cannot stand for and the community cannot bear. So my question, Mr. Speaker, how long will it take until there are a sufficient number of mental health professionals in Cape Breton so children aren't separated from their family along with their other issues?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising this question, this concern, which, as he noted in the data he provided, affects not just his constituents, but indeed expands to many other parts of the province. He cited in the data my own constituency in Antigonish and the need for additional supports there as well. I can assure the member that the NSHA is recruiting actively for psychiatrists as well as other mental health clinicians and family family practice primary care providers. Mr. Speaker, we know that there's more work to be done, but we're also having success, Mr. Speaker, and indeed just about 2 or 3 weeks ago, I had the opportunity to meet with prospective specialists. A psychiatrist was one of those prospective specialists looking to move to the eastern zone. So again, the work is ongoing and we are having interest.
The honourable member for Pictou East.
Thank you, Mr. Speaker. Mr. Speaker, mental health services are a concern for the people of Pictou County as well. The demands for mental health services greatly outpace the availability, particularly since the temporary closure of our short stay unit 3 years ago. Access to help is hard to find. Follow-up is lacking. Many people don't have a family doctor and they're forced to go to a walk-in clinic to try and get a referral to a psychiatrist, and you can imagine how that works out for them, Mr. Speaker. Residents of Pictou County are forced to do without access to services or maybe try to drive down the road to another hospital in Antigonish or Truro. And we know now, we've heard there's no guarantee they'll get access there. So my question for the minister is, can the minister tell me whether he believes the Nova Scotia Health Authority is providing adequate mental health services to the people of Pictou County?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We continue to provide supports to Nova Scotians in need of medical care, whether that be physical or mental supports. Mr. Speaker, the nature of the conditions that one is presented with will dictate the course of action and treatment that would be provided. There are many different courses or paths of treatment, community care, in inpatient care, as well as consultations with specialists, or perhaps in some cases a specialist is not required and other mental health clinicians provide those services. So again, Mr. Speaker, supports are available. We continue to work to expand those supports and we're investing to do more. Thank you.
The Honourable Member for Pictou East.
Mr. Speaker, supports may be available. The question is, are they adequate? And I think the answer is obviously no, they're not adequate. If there is a theme that surrounds the current healthcare system, it is crisis. Crisis and uncertainty. When they need help, Nova Scotians can't be certain that there'll be an ambulance available when they call 911. When they get to the hospital, they can't be certain that the emergency room will be open or able to provide adequate care and services. And with mental health, they can't be certain that the service will be available at all. And so what I'd like to ask the minister is, can the minister offer some level of certainty by telling this House that what he has planned for mental health services in Pictou County to improve the current situation? What does he have planned?
The Honourable Minister of Health.
Thank you, Mr. Speaker. What the member would know is that as a government, we've committed in our budget for this year to continue our investments in mental health supports. We've specifically targeted investments towards youth mental health as a major component of that, Mr. Speaker. With our partnership with the Education Department through Schools Plus to provide clinicians, Mr. Speaker. We continue to recruit for other specialists, psychiatrists throughout the province to enhance and strengthen our support teams for mental health services inside our hospitals and within our communities, Mr. Speaker. The member is right, there's more work to be done, and that's why we're continuing to invest in this as one of our key priority areas. Thank you.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question is once again for the Minister of Community Services. As we've already heard, an independent review in Ontario of hair strand testing by the Mother Risk Laboratory found the testing to be inadequate and unreliable for use in child protection proceedings. The report found that as a result of Mother Risk, children were wrongfully removed from their homes. One Hamilton mother lost custody of her daughter for 6 years based on the faulty testing. And we know this testing was also used as evidence in protection cases here in Nova Scotia. The minister has told us that the hair testing is only one of the factors that goes into the removing of children from their homes. But if the test is faulty, it should be completely discounted. Mr. Speaker, will the minister agree to review all instances where Mother Risk testing was used in Nova Scotia instead of putting the responsibility on vulnerable individuals to bring forward a complaint?
The Honourable Minister of Community Services.
I want to thank the honourable member for her question. I want to assure her that in cases where child custody is being investigated, we have a number of different tools that we use to determine whether or not a child should be removed from parental custody. I want to assure this honourable member that we, in fact, a lab test would only be one of many different standards that would be looked at when custody is being decided. Thank you.
The honourable member for Dartmouth North.
Mr. Speaker, a senior lawyer with the Nova Scotia Human Rights Commission says that the provincial government owes it to the families to look into whether faulty drug tests have resulted in the unjust removal of their children. Many people who are potentially affected don't have the resources to argue over this with the department. Yesterday, in response to a media story, ADSM for Women and Children tweeted that they were reminded of a mom who was adamant she was not using drugs, and that when the hair test showed positive, she felt defeated. Mr. Speaker, given how the system has failed these families, does the minister think it is reasonable to expect them to come forward to that same system now?
The Honourable Minister of Community Services.
I want to assure the honourable member we take the care of the children who are in the care of the minister very seriously. We understand that this is a very difficult thing for a family to go through, and I want to advise her that if she is aware of any cases at all where people believe that they had faulty tests, to please just contact the department and we will make sure there is a review done. Thank you.
The honourable member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker. When the House last convened, I asked the Minister of Health and Wellness numerous times whether or not there might be any future plans or opportunities that would see emergency services at the Cobequid Community Health Centre in Sackville offered 24 hours a day, even if only just over the weekends. I've gone back through Hansard, and I understand that the Minister's response at the time were provided in the context of overall primary care services and collaborative centre plan. However, he did mention at that time that the option had not really been looked at. My question, therefore, to the Minister is, now that that question has been raised in the legislature, is there any opportunity that the residents of Sackville, Beaverbank, Bedford or Fall River can anticipate anything in this coming budget that would establish emergency services at Cobequid Community Health Centre 24 hours?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. The budget will be coming down this session. I'll defer to that time, Mr. Speaker, rather than jumping ahead of any investments that may be announced as part of that. Thank you.
The honourable member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker, and thank you, Minister. I'll look forward to that. I do realize that the Cobequid Community Health Centre does not currently offer food services to accommodate patients. Beds are designed for services rendered and not necessarily for admissions. There are insufficient resources there. There are no on-site laboratories, radiology or subspecialty services that are available after midnight. So my further question is, am I correct in understanding, and if the Minister could clarify, that all these services would therefore be required at Cobequid Community Health in order to have that facility open 24 hours?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The member would be correct that there are a number of requirements that would need to meet the clinical requirements to fulfill emergency care over 24 hours, which may include admissions. Mr. Speaker, as the member would know, we are working on the QE2 redevelopment, and part of that process is looking at evaluating the services, how and where they're delivered across the province. Thank you.
The honourable member for Cumberland North.
Mr. Speaker, I'm very concerned about the unsafe conditions in my constituency with the closures of the Pugwash Emergency Department. My residents in Pugwash and surrounding area are worried. They never know, Mr. Speaker, if the emergency room is open or closed. The communication plan does not work, and this is creating unsafe conditions for our people. Sick residents of Pugwash will often go to the emergency department to be turned away. My question to the Minister of Health is, when will he please take the healthcare needs of the people of Pugwash seriously and find an urgent plan and make them a priority and their healthcare needs a priority?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'd like to make sure that the member opposite is clearly aware that indeed I take the concerns and the needs of all Nova Scotians, and including those in Pugwash and throughout her constituency. The process for managing ERs, particularly in our community hospitals, Mr. Speaker, first involves an extensive effort to ensure that physicians are available and the required healthcare staff. Every effort is made to find staffing for those shifts when the need arises. And Mr. Speaker, they work as hard as they can to get those positions filled to try to avoid any closure time at these facilities.
The honourable member for Cumberland North.
Unfortunately, Mr. Speaker, it's not the only emerge department that's closed in my area. Often Spring Hill and Parsboro emerge departments are also closed, putting all the pressure on the Cumberland Regional Healthcare Centre. That regional hospital emerge department has one physician, often covering an area up to covering 40,000 people. The result, Mr. Speaker, is chaos. Horrible wait times, ambulances that can't offload their patients, and people are getting angry. And what upsets me, Mr. Speaker, is they're getting angry at the wrong people. They're getting angry at the doctor, they're getting angry at the nurses that are working in these unsafe conditions. They should be directing their anger, Mr. Speaker, at this government, who refused to take care and make changes in this crisis. What is the Minister of Health planning to do to stop these emergency room closures?
The Honourable Minister of Health.
Thank you, Mr. Speaker. There are a lot of work that is ongoing, Mr. Speaker. These challenges with getting the staffing in some locations, it's physicians, and others it's nursing staff, Mr. Speaker. It's not a challenge restricted to Nova Scotia. Indeed, just in the last couple of weeks, right across the border from the member opposite, a large hospital in Moncton actually had their emergency room shut down due to staffing shortages, Mr. Speaker. This is a challenge facing healthcare centres across the country. We're continuing to work to improve the situation, Mr. Speaker. Part of that is recruitment, and we're continuing those efforts throughout the province.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Fisheries and Aquaculture. The Minister's explanations, both in this House and to the media, with respect to the Jordan Bay Cook Aquaculture site defy belief and, quite frankly, are incomprehensible. The severity of the storm at Jordan Bay in December, which had wind gusts over 170 kilometres an hour, and reports from the local fishers would paint a much different picture or photograph. And yet the minister sticks by his story, relying on information provided by Cook Aquaculture. We still have no independent verification or veterinary reports from the minister or his department that will ease community concerns. My question is, when will the minister stop protecting Cook Aquaculture and start supporting the concerned citizens in the community, industry, fishers, and ultimately the consumer?
The Honourable Minister of Fisheries and Aquaculture.
Thank you very much. And as I said here in the House before, we did investigate the situation in Jordan Bay. We will continue to do that if need be. My understanding, everything is cleaned up. It has been cleaned up as required under the Act. And indeed, we incurred a substantial amount of cost, around $14,500, just reviewing the site to see what happened in the site. Everything was done by the book, and absolutely everything is cleaned up.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, the minister told Nova Scotians that any issues regarding escaped or deceased fish were the responsibility of the Department of Environment. However, it is the responsibility of his own department. Then the minister referred individuals to call an incorrect number to voice their concerns. Finally, the minister informed individuals to contact the Cook Liaison Committee, but apparently that committee doesn't even exist. Residents are generally concerned about what's going on at this site. Cook Aquaculture was fined in other jurisdictions for being negligent and having poor maintenance practices. My question is, will the minister release a detailed time of events outlining when his department sent their divers and their veterinarians to inspect the fallout from this event and report results from those inspections?
The Honourable Minister of Aquaculture.
As I've already indicated, everything was done by the book. We had veterinarians on the site. It was supposed to be done under the regulations. And indeed, Everything was cleaned up the way it was supposed to be cleaned up, and unfortunately, the member didn't understand that we did that, and environment was also involved in enforcement. We did everything by the book, and everything is done properly.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question is for the Minister of Environment. Nova Scotians have not been able to recycle plastic bags for over 2 months now. Halifax is sending bags to landfills, and in Colchester County there are 17 shipping containers filled with compacted film plastics. So Nova Scotians are calling for a province-wide ban on plastic bags. So my question for the Minister is this. Could he please tell this House if the government plans to implement a ban on plastic bags, and if so, when?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. And so the only municipality thus far that has asked for an exemption to put film plastic into a landfill is HRM. I'm not aware if they've done that, but it is an option of last resort. I want to remind the member and all members of the House that today, even before that variance, the vast majority of film plastic does end up in a landfill, unfortunately.
Order, please. Time allotted for oral questions put by members to ministers has expired.